New COVID variant is spreading across the country. Omicron's subvariant BA.5 caused an estimated 65% of new COVID infections in the U.S. last week, up from 54% the week before. That's according to CDC data. Meanwhile, the Biden administration is working on a plan to approve a second round of booster shots for all U.S. adults. With me now, Chief Medical Advisor on COVID-19 to President Biden and Director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Dr. Fauci, great to see you again. What's the most
Thank
concerning
you. Good to
part?
be with you, John.
What's the most concerning part about this BA.5 subvariant?
Well, it has what we call a transmission advantage over prior variants. As you know, we've gone through BA1, BA2, different numbers, BA2.1, 2.1. Now we have BA5, which clearly, because of its ability to evade immune responses, either from the vaccine or from people who have been previously infected, the ability to infect an individual is enhanced over prior variants. And that's the reason why you're seeing us where a reported 140 or so thousand cases a day. It's likely a gross underestimate because so many people get tested with home kits and don't report it. So we're probably seeing a multifold greater number than that 140,000. Deaths are still around 300, but hospitalizations, John, are ticking up. So this is something you don't want to panic about, but we really need to pay attention to it because there are things that we can do to blunt that. I mean, we still don't have as many people vaccinated as we need, only 67% of the population. Only half of those are boosted. We need to be using the mitigations that we have available. Masking where appropriate, vaccinating people who aren't vaccinating, and boosting people who are ready and eligible for their boost. We can do that, but we're not doing it to the extent that we should be doing it.
You said this new variant increases likelihood of reinfection for people who have had it. How quickly can you be reinfected?
Well, you know, it really varies, John. I mean, usually immediately after you've been infected, within a period of weeks to a month or so, you're pretty much protected because of the immune response. Some people, and they're outliers, have been documented to be infected weeks to a month after the initial infection, but most of the time the protection lasts for a few months. But if somebody was infected several months ago, particularly if they were infected with Omicron, the protection that's given to you against BA.5 wanes and diminishes pretty rapidly over a period of several months.
If you haven't received a shot this year, a booster or your second vaccine dose, if you have not received a shot in 2022, how much has your immunity waned?
Considerably. I mean, the thing that is important to note is that immunity against infection wanes pretty quickly and it goes way, way down. What we've been fortunate is that the immunity against severe disease leading to hospitalization and unfortunately death in some cases tends to hold reasonably well. But it's slipping where it was up to 90, 80, then it goes down to 70, 75, 65, and 50. Then you're really in a situation where you really do need a boost. And we know when you get out 6, 7 months or so, we're now in July, we're in the 7th month of the year. Most people who have not received a booster this year have a diminished immunity.
Should people be masking indoors again, given the extra infectious nature of this new variant?
Well, as the CDC makes it very clear, depending upon the density of infection and the dynamics of infection in the place where you live, and you see if you look at the map, where just a couple of months ago it was a lot of green and some yellow, now we're seeing a fair amount of orange, which means you really should, in an indoor setting, a congregate setting, be wearing masks. It's just the appropriate thing to do to protect yourself and your family and those around you, because you could get infected and inadvertently, without any symptoms, transmit it to someone perhaps in your own household who's vulnerable, either an elderly person or someone with immune compromise. And that's the reason why when you're in an area where the infection dynamic is high, you should wear a mask in a congregate indoor setting.
What's the current timetable, do you think, for approval for Americans under 50 to get their second booster shot?
Well, it's being very seriously and actively considered, John. We were talking about this just literally every day for the last couple of days. Obviously, this is something that is an FDA regulatory decision. Those are the people most qualified to look at the data and to make a decision whether or not they would extend the regulation to be able to give it to people less than 50. But I can tell you this is something that is being actively discussed. I can't predict if and when it will happen, but I believe it's going to be within a very reasonable period of time.
We're happy to see you because we know that you had COVID. How are you feeling now? And what did you learn from getting through it?
Well, first of all, thank you for asking, John. I appreciate that. I'm actually feeling fine, and I think I'm an example of someone who, because of my age, falls into a high-risk category. I was vaccinated and doubly boosted, and I'm relatively certain that had I not been vaccinated and doubly boosted, I might have had a much more severe course than I had. I was fortunate. It was relatively mild. I've completely recovered, thank goodness. I feel back to normal, but I don't think it would have been that way had I not been vaccinated and boosted.
All right, Dr. Anthony Fauci, we're glad you're back to normal. Nice to see you again.
Thank you, John. Good to be with you.